Thanks for staying with us. A TB at Health NGO Right to Care is calling for people to be tested for the disease to avoid new transmissions of it. Let's discuss this further. And now I'm joined by Dr. Lucy Connell, TB Program Lead Right to Care. Very good afternoon to you, Dr. Connell. Thank you so much for your time. Let's go back to what will soon be the 27th of March. I mean, going back to 2020, South Africa woke up to the very first day of a hard lockdown. We saw how it impacted access, especially access or a lack of access to health care, because the priority was focused on COVID-19, with the fears and concerns around it, especially, the access was a huge factor for those with chronic illnesses who needed chronic medication. What do you recall of the time? I mean, we're soon going to the 27th of March of 2022 as we take a look at what happened 2 years ago.
Well, what I remember was panic in the health system, with the rapidity with which people got sick and needed care, and the fact that we were going into this pandemic with no understanding of the disease at yet and how to prevent deterioration, how to manage people who are severely ill. And I just remember, although I wasn't directly at the clinical interface, just the exhaustion of health workers as they were buffeted in that first wave, and then with barely a breath in each successive wave until the last one, thank goodness, although really burdensome in terms of numbers, slightly less exhausting in terms of how sick people were. So I do remember that, and I remember the hard lockdown where we were corralled in our homes, we didn't go anywhere, and then when clinics did open up, the successive closures of clinics sometimes for days because we didn't yet understand that we didn't need that fumigation and that sort of cleaning that we were obsessed with. And I can understand why it disrupted our health system. But I think that now is the time to be able to plan going ahead to say, how can we manage our routine care of all our health burdens and not just COVID?
Absolutely.
And on the COVID front, especially, we have an effective tool. We have vaccination. So the whole country needs to be pulling together to vaccinate everybody so that COVID does not unnecessarily derail our health system again.
And a lot of health experts have spoken to tuberculosis, essentially referring it as South Africa's easily forgotten killer that needs the same investment that COVID-19 has received.
Absolutely. I mean, it kills millions of people every year. In 2020, it killed 1.5 million people, and that was an increase on the year before. And why that is so staggering is that we have not seen an increase, a year-on-year increase for the last 12 years in the world. And even with South Africa's mortality statistics, in the last global TB report, which covers data from 2019, we can see an uptick for the first time in over a decade in TB deaths in South Africa. And this is for a condition and an infectious disease that is absolutely preventable and treatable, curable, should you have it.
How much of an impact 2 years on has the COVID-19 pandemic had on treating tuberculosis and new cases that may be surfacing with people who may be presenting no symptoms?
Okay, well, first let me just talk about what we're used to, which is people are symptomatic presenting to clinics, and then you diagnose them and you put them on treatment. Our Chief Director of the TB Control Program shared with us last week that although we're recovering from being knocked so hard in the initial waves of COVID, we are not back yet to pre-COVID levels in terms of the amount of people we're diagnosing, the amount of people we're putting on treatment, the amount of people we're putting on preventive therapy, and the proof of the pudding, the amount of people who were finishing their TB treatment and remaining TB free. So although we're recovering slowly, we have not recovered to pre-COVID levels. So we've got to recover, but we also have to recover what we've lost. We have lost hundreds of thousands of people that remain undiagnosed. So let me just explain to you, already within our health system, we were undiagnosing TB to the tune of over 100,000 people every year. And we now understand that a large proportion of those undiagnosed people are people who don't get picked up because they don't yet have symptoms. But if you were to x-ray them, you would test them because you would see changes suggestive of TB on their x-ray. So we were not picking up enough people even before the COVID pandemic, and now we have missed out on diagnosing and reaching hundreds of thousands of people. So it's really a lot of catch-up that we need to do, and it's got devastating consequences, because the longer you leave TB undiagnosed, the more damage it causes, the more likely you are to have sequelae in later life, and what's worse, the more likely you are is to transmit to people around you. And that's why we're not winning with controlling the epidemic. That's why we're not bringing the numbers of new cases every year down, is because we're not finding everybody.
I suppose another reason you're not winning is that even those with symptoms are not coming forward. Who exactly is at risk?
Okay, so possibly the largest group for us in this country are people living with HIV, because even if you're on treatment and your immune system is relatively strong, you still remain at higher risk for getting TB. Obviously, the more advanced your HIV disease is, and the later you delay treatment, the more you are at risk, but the risk remains. We also know that people who are malnourished are more at risk, and in this country that is a lot of people. We know from the rates of stunting in under 5 children that people in South Africa do not get enough to eat. And we know that COVID has further forced our country deeper into poverty. And then we also know that people who are contacts are at risk, very young children are at risk, people with other comorbidities such as diabetes are at risk. So all of those people have a much higher risk. And in fact, people who've had TB before, that speaks to the residual damage that is left behind even when you successfully treat TB. They are more at risk of getting TB again. And what we also know now is that although HIV infection places you at increased risk, there are many, many HIV negative people undiagnosed in this country. And in fact, the single group that has the biggest gap between TB disease and being diagnosed within our health system are HIV negative men. So first of all, I think it's a myth that if you think your last HIV test was negative, you can't be at risk for TB. Of course you can be at risk, especially if you are living or working with someone who's had TB. And men access clinics much less often than women because they don't have the same reproductive mechanics that bring them to clinics, and they play much less of a role in childcare, so they're not coming to the clinics to preserve the health of their children, and so they are a big group that we are failing to reach. So, I mean, the message for men is that, you know, you're more likely to have TB than women. And the message for government and the health system is that we can't wait in clinics for people to come to us. We need to go out and actively find people. I mean, it's not rocket science. We are now able to map geospatially communities that have already high rates of TB diagnosed. And then we know we just need to go to those communities, especially if people are living in conditions that promote the transmission of TB, such as overcrowded informal settlements where it's very difficult to achieve good ventilation and not to have people crowded sharing the same air.
What about the symptoms of TB? I mean, surely there must have been some sort of uncertainty or perhaps a very thin line as the COVID-19 pandemic took over and those symptoms were highly monitored as opposed to those which may be similar to tuberculosis.
So many of the symptoms overlap, like cough, fever, night sweats. And so initially, all this effort was being put into screening for COVID, for example, at the gate of a clinic to determine who might be symptomatic so they could be given their care in a designated area without having to go and sit in waiting areas inside the clinic. And then after a while, government realized that, okay, they share symptoms. If you're coughing, you need to be tested for both conditions. We need to exclude COVID and we need to exclude TB. So that's actually what you see in many clinics countrywide now, is that people are screened for both at entry. And whether you're diagnosed with COVID or not, the fact that you've had shared symptoms means that you also need to produce a sample of sputum, which is mucus from deep inside your lungs, for TB testing as well. So that's sort of one of the examples of the way in which you need to concentrate on integrating care and making sure you're managing both conditions at one stage. And that sort of approach needs to be multiplied everywhere. And for example, we as citizens, we can log on to multiple platforms any time of the day and see 24-hour-old data about new COVID infections. There's no such facility for TB. So no wonder people don't think TB is an issue. There's no way that these metrics are shared with people and that they can also participate actively in the way they manage their lives to protect themselves or seek care. So there are many COVID innovations that show that where there's a will and where the government is very scared and many other things are at stake, you can manage illness and new conditions very, very effectively. You can come up with a vaccine in the shortest possible time. You can have very good digital data. You can have something like the EVDS that keeps a record of everybody who's vaccinated and speaks to people via their phones. All of these innovations should be things we are using for TB too.
And I know there's a national TB plan. Is government on track with it? I mean, you make mention of the strides that were made with COVID-19. What's the national plan looking like?
The national plan has been ready for months and months and months. The National Department of Health has a forum called the TB Think Tank, which brings together government policymakers, government implementers, academics, and NGO supporters of government who understand the health system very well because they've been supporting it around TB and HIV and maternal and child health care for years. They bring them together in a forum that meets regularly to say, what are our research needs? What is the evidence coming out of research? And how do we need to translate that into policy? And the TB plan, the key things that need to be done, have been ready for over a year now. I'm not sure of all the reasons why there is the delay, but there is a delay. And I think from what I've seen is that it shows a lack of political will. The health department itself doesn't always get the type of response it needs from its own political principles and people in government. So in the same way as that COVID became a national disaster and we took an urgent approach of dealing with it, that same impetus, that same sense of urgency is not applied to TB. And if you had to count the death toll from TB over the decades, COVID mortality fades into into something much smaller if you have to count the death toll from TB.
Yeah. And very lastly, Dr. Connell, as we look at perhaps new technology and methods of testing and detecting, where are we standing with tuberculosis?
Okay, so South Africa has lots of lovely innovations and leads lots of innovation. So, for example, in the field of drug-resistant TB treatment, we pioneered trials for new drugs and for shorter regimens, and especially regimens that did not include injections that make you deaf. We need treatment, better treatment for drug-resistant TB with less side effects that takes shorter to complete treatment. We need the same for drug-sensitive TB. One of our big problems, though, is detecting people with TB. We still don't have an easy, relatively inexpensive point-of-care test that can tell definitively whether Lucy has TB or not, in the same way that you can do with a finger prick and a rapid test for HIV. So that is one of the really big things that we need to beat, and there are lots of candidates, but there's no single candidate that solves the problem on its own. So the government has got lots of challenges in integrating multiple approaches and new technology to see which blend of these approaches is going to make sure that we find the most people. And then, of course, we need a TB vaccine, and it's quite hard to find the right immune target that would make a good vaccine. But once again, the question of vaccines just shows how seriously the world takes TB. We've got about 150 COVID vaccine candidates in the pipeline. With TB, we've only got 9 in advanced states of testing. And after those 19, if none of those work, we've only got 2 or 3 in the early phases of testing. So we definitely need those things with TB, but we can see that the political will isn't there. The funding that was promised is not allocated, and there's just not the will to develop those things. And I think that's largely because of who gets TB in the world.
We're going to have to leave it there. Thank you so much for
your
time.
Thank
Dr. Lucy Connell, TB Program Lead from Right to Care, speaking as World TB Day was held yesterday, also speaking to some concerns around TB and, of course, speaking and highlighting some of the big challenges that still remain.